Welcome to the Seeing is Believing Southeast Asia and Western Pacific Regional Webinar. Thank you all for attending today. I know how busy everyone is, and I really appreciate you taking the time to join us. We have over 30 people registered from 10 countries in the region, which is fantastic. If you would like to introduce yourself to the group today, you can write your name and which country you are from in the chat box on the side panel. A big thank you to our webinar presenters. We have Arundhati Bhattacharjee, the Programme Officer from Sightsavers India, Guan Chunhong, the Senior Programme Manager from Orbis China, Mr. Phan Ngoc and Tuan, the Project Manager, the Fred Hollows Foundation, Vietnam, and Sally Crook, the Seeing is Believing Programme Manager, IAPB. So the agenda for the webinar today will be welcome and housekeeping points from myself, a brief introduction from Arundhati on working with governments in the Southeast Asia region, presentations from Guan and Tuan on how they work with governments in their Seeing is Believing projects. Fourthly, I will chair a question and answer session after the two presentations. And finally, Sally Crook, the Seeing is Believing Programme Manager, will make some concluding remarks. So the webinar will take an hour in total. Firstly, some housekeeping points. So I will share my screen and show the first PowerPoint presentation. So you should be able to view my computer screen through your GoToWebinar window. I've actually forwarded you the PowerPoint presentations in advance. Microphones are muted apart from the speakers, as this ensures a better quality webinar. The sound is just a bit better this way. So we'll be doing a question and answer session at the end. So if you have any questions for the presenters, please type them in the chat box. The chat box can be found on the right-hand panel of your screen, and you can either post questions during or after the presentation. And please do sort of be bold and ask your questions, because we do want these webinars to be as interactive as possible. Okay, and my colleague Emma Foote is supporting us today with technical issues. So if you have any technical difficulties, for example with sound, you can send us a message in the chat box. And thank you, Emma, for your support today. And it's a good idea to close down all other web applications, for example, Google, Outlook, Skype, to get a better quality of call. And if you have headphones, please use them too. I am recording this webinar and it will be uploaded onto the IAPB website, and I will send around the link in a few days. Finally, at the end of this webinar, I will be sending you a survey for your feedback. So the theme of this Seeing is Believing webinar is working with governments. So the presentations today will explain how they've succeeded in engaging ministries of health, education and disability at the national and provincial level in their projects, and in doing so have had a wide and sustainable impact. So I'm now pleased to introduce Arundhati Bhattacharjee, the Programme Officer for Sightsavers India, to give an introduction to some of the challenges and opportunities of working with governments in the Southeast Asia region. So Arundhati, over to you.
Thanks to Suzanne and IAPB for providing me the opportunity to introduce today's topic on opportunities and challenges to work with government within SIB projects. It is very important to work with government to make an ICARE program sustainable and delivering tangible outcomes. It is a mandate for Sightsavers to work with the government within and outside the scope of SIB projects, as sustainability is one of the key strategies for delivering more comprehensive ICARE programs within SIB projects. So working with government in a health system approach is inbuilt in our strategy. The opportunities of working with the government are many. Non-governmental organizations often produce change in small hand-to-mouth quantities. Nevertheless, partnership with government helps to influence larger systemic changes rather than addressing small gaps. The ownership of the program improves and ensures sustainability beyond the project cycle. To make government accountable and a party in prioritizing and implementing eye health programs, Sightsavers signs MOU, which is a Memorandum of Understanding with each state authorities as a part of the process. Under the Phase 5 project, Sightsavers supported only the institutional cost to the partner for cataract surgery, whereas the cost of the consumables for the surgery was sought from the government-sponsored scheme called the National Program for Control of Blindness. Collaboration was made with the School Education Department for screening of school children, where teachers conducted the primary level screening. Convergence was also made with the Department of Child Development, which helped in conducting camps in Anganwadi centers, which are commonly known as courtyard shelters for below 6 years preschool children, for their eye screening and identification of pediatric cataract. However, the word government is many times synonymous with bureaucracy. Government is huge, and in order to manage all agencies, employees and programs, there is a complex system of rules and procedures in place. Frequent changes of government functionaries can be frustrating at times. Many times eye health issues are not prioritized by government, and focus also shifts to other emerging health issues like mother and child health, immunization, vector-borne diseases, etc. The government infrastructure are huge but not fully equipped in terms of providing eye health services. We have found that standards and protocols are not in place in spite of upgrading of the infrastructure. Optimum usage of the facilities have not been possible, which is also a major concern. There are also lack of professional attitudes of government officials and ophthalmic paramedics to work together. However, I would sum up that in our interaction with government bodies, we have found a consistent narrative. They want to make sure that the work of NGOs are not parallel but complementary to the work done by the state. And they also want organizations to come together and help them to achieve the national priorities. Thank you.
Thank you, Arundhati, for that insightful overview. Right, for our presentations, firstly, let me introduce Guan Chunhong, the Senior Program Manager from Orbis China. I am just making sure that Guan, I'm just going to unmute Guan, mute Arundhati, and then I'm going to be clicking through the slides. So Guan, over to you.
Thank you, Susan. Hello, everyone. This is Guan from Orbis China. Today, I would like to share how we are working with multi-government sectors to increase access to child eye health service in Shanxi Province, China. The cross-sectional partnership involves Bureau of Health, Education, and Disabled People's Federation at all levels. Click through, please. Establishing, strengthening, and sustaining a system is a core of comprehensive child eye health. Children most time are studying in school or at home. So working with Education Department, Disabled People's Federation, and the family is important, but is also challenging. The project is designed to provide the promotive, preventative, curative, and rehabilitative services. Leaders from Education and the Disabled People's Federation asked us, why do we need to involve in child eye health? After we answered their question, then the next they will ask, how should we support health professionals for child eye health? Moreover, when we convinced the leaders to authorize school principals to support screening, some principals still made excuse to refuse deploying teachers for attending the training in screening and referral. On the other hand, health professionals were doubt whether teachers could identify children with eye problems. They didn't realize that teachers would only do initial vision assessment and identify any suspected abnormality of the appearance of eyes. Next, please. These are key strategies we used for overcoming the challenges in the project. Those points in red are particularly important for working with governments. Top-down and bottom-up approaches. Provincial government is powerful in coordinating health, education sector, and the disabled people's population to working together in project and strong in in health policy change. Community and county level provided evidence from the project to high-level government. And they are strong in demonstrating outcome of policy change. It is important to know the new policies from health, education, and disabled people's population. So it could be used as advocacy tools in terms of common language or interest. For example, we use policies such as Health for All, myopia prevention and control, jointly issued by 3 ministerial sectors, the hot topic of targeted poverty alleviation and gender equity in education, etc. We promoted the project providing a range of affordable quality eye care service to all children. Disabled people's population receives low vision devices donation, but it is not capable for a reflection and assessment. So we encourage them to collaborate with low vision clinics. Then children will be referred back to disabled people's population for physical rehabilitation. Disabled people's population also shared their common community-based network for case identification. Information and achievement are regularly shared. Leaders from multiple government sectors were invited to every annual meeting, so they are aware of agreed objectives achieved and where each sector contributed to. We also acknowledge the quality of support of each sector in the presence of their supervisors and among all sectors. Other strategies include inviting them to events such as Children's Day, National Sight Day, and World Sight Day. In particular, for new leaders of government, training to teachers in screening also created the misunderstanding that teachers are not to make diagnoses, but identify and refer suspected cases. So the principals, they are willing to send the teachers for training. Click through, please. Sorry. We have gained a number of key learnings.
Sorry, Guan, just to jump in. Do feel free if you just need to grab a glass of water or something. We can wait for you if you're having a bit of a coffee. If you need to grab water, do feel free.
Yes, sure. Just a sip of water. Thank you.
Sure. We'll just give Guan a chance. Thanks everyone for your patience.
Yeah. Okay. Now, thank you. We have gained a number of key learnings from our experience of working with government. But here I would like only introduce 2. The first one is embedding primary eye health to primary healthcare system. The primary eye health was not integrated into primary healthcare, although visual acuity was listed on health recording form at primary level. We noticed it was left blank during our visit to village health clinics. There are staff assigned for health assessment to children aged 0 to 5 at Township Health Center, but actually nobody knows how to check eyes of children under 4 years old. The second learning is the project influenced the change in health insurance scheme. This is a big and valuable learning not only for NGOs but also for local partners. Collaboration with health insurance center is very important for making realistic change to current schemes. Click through, please. I would like to explain more about our experience in embedding primary healthcare into primary healthcare system. We worked with government sectors to strengthen and utilize primary healthcare health system in terms of prevention and referral of eye problem through village doctors. We supported the training to village doctors about basic knowledge and simple skill of common eye disease. We integrated the training into primary healthcare training agenda arranged by local township center. We also integrated training into screening training to teachers and to rehabilitation workers. We motivated the village doctors, rehabilitation workers, and teachers to act as key informants to identify and refer cases. Meanwhile, they also are very happy because their profile among villagers raised through their work. Village doctors have basic health records and insurance scheme of each child in their working area, so it is important to improve the eye health part of village doctors. We acknowledge their contribution. We established a referral pathway with local hospitals, schools, and the community. Click through, please. Another key learning from our working with governments is we were able to advocate the change in health insurance. Health insurance does not reimburse for strabismus surgery in most places in the country. In the first year of the project staff of Provincial Eye Hospital proposed this to Health Insurance Center because they believed many children would benefit from it. The staff of Health Insurance Center listened to them and advised them to submit a request for change with the support of pediatric ophthalmologists. Because staff of health insurance had no knowledge about the disease. Within a half year, the policy was changed as a pilot case in the provincial hospital. Then it was expanded to some other places, but still not yet to whole province. So we always include health insurance to cover strabismus surgery and spectacles as a key advocacy topic in the project. In terms of sustainability of service access and utilization, we held a high-level forum with leaders from provincial health and education sectors and the Provincial Health Insurance Center and the Disabled People's Federation. The leader from Health Insurance Center was so glad to participate in the forum. He emphasized that they really want to work with hospitals to make more practical policy of health insurance. Click through, please. At the high-level forum, international NGO and provincial hospital signed and submitted a suggestion letter to each of health and education sector, Disabled People's Federation and Health Insurance Center to advocate governments to take over 3 key areas from the project. The first is to conduct annual school screening and follow up children with myopia or eye problem for early prevention, detection, and intervention. The second is health insurance to reimburse strabismus surgery and free spectacle for children from poor families. The third is to provide appropriate educational interventions to children with vision or multi-disability to improve their quality of life. This is the letter jointly signed by Orbis, Helen Keller International, Brian Holden Vision Institute, Perkins International, and local provincial eye hospitals. That's all from our project sharing. Thank you.
Thank you, Guan. That was wonderful. And thank you for highlighting both why and how you're bringing together the education, health and disabled people's federation sectors, as well as the key strategies you've found effective in encouraging collaborative working. It's especially interesting to see how you're embedding primary eye health into the primary healthcare systems and how the project's engaged with the health insurance. Just as a reminder to our audience, if you have any questions for Guan, please type them in the chat box and I will ask them at the end of the 2 presentations. So please do, if you think of any questions, do sort of jot them down and I'll ask them at the end. So now what I'm going to do is I'm going to stop showing my screen and I'm going to change presenter. And I'm going to make Mr. Phan, Ngoc and Tuan the presenter, and he's going to share his screen, and then he's going to take us through his presentation. So let me introduce Mr. Phan, Ngoc and Tuan, who's the project manager for the Fred Hollows Foundation Vietnam. And so Tuan, Over to you. We can see your screen now, so please start when you're ready. I will just, let me make sure you're unmuted. Okay, Tuan, over to you.
Okay, thank you, Susan. First of all, I would like to say on behalf of Vietnam Child Care Project, I'm very happy to share some working experience with the government agency in Vietnamese context. And my presentation will have a 4 parts. The first part is about project management, and the secondly about role and responsibility of the National Project Management Board and Provincial Project Management Board. And the third part is about some challenges that we are facing and the lesson learned that we have. And finally, some the partnership suggestions for working with government agency in Vietnamese context. And regarding the project structure, and according to our project design, we have working with the project management board at 2 levels. One in the central level in Hanoi capital, when we're dealing with the Ministry of Education and Ministry of Health, and we call that National Project Management Board. And at provincial level, you know that we are working in 3 project province, and we call that Provincial Project Management Board. Regarding to the role and responsibility, you know that a National Project Management Board, there are key members from General Department of Preventive Medicine. That department belongs to Ministry of Health. And another member from Department of Student Affairs belongs to the Ministry of Education and Training. At the province, we are set up the 3 provincial project management board. There are key members from provincial district Department of Education and Training and Department of Health, Department of Preventive Medicine, and Eye Hospital. And regarding to the role and responsibility of the national PMB, you know that it is the government agency to establish, to ensure and provide technical support for province. You know that GDPM is responsible for preventive health insurance, including eye care, and the DSA, Department of Student Affairs, is responsible for education, student affairs, physical training, communication, event in school. And another role and responsibility of national PMB is to provide technical support and conduct project monitoring in project area. And the key and very important role and responsibility of national PMB is to provide the support on the policy and advocacy within the project. And regarding to the role and responsibility of the provincial PMB, the first is collaboration and implementing project at province. And secondly is planning, implementation, monitoring, and reporting. And the third is provide technical support for the district and school. And capacity building for school nurse, form teacher, community health worker, the student. And finally, it is self-funded with the Fred Holler Foundation through the training venue and staffing for screening, monthly allowance for the PMB member. And from the chart, and you can see at the national PMB, they are the key member from Department of Student Affairs. It belongs to Ministry of Education and Training, and the General Department of Preventive Medicine. It belongs to Ministry of Health. You know, in Vietnamese context, the DSA, Department of Student Affairs, responsible to provide technical support for Provincial Department of Education and Training. And at provincial level, the Provincial Department of Education and Training provide and manage the District of Education and Training. In the health sector, the General Department of Preventive Medicine is responsible to provide technical support for Provincial Department of Health. And at provincial level, the Department of Health manage and provide technical support for Provincial Center for Preventive Medicine, Eye Hospital, Private Optical Shop, District Eye Unit, and District Center for Preventive Medicine. And Vietnam Child Eye Care Protect Team, we are working both with the national PMB and provincial PMB, and our staff also conduct regularly monitoring at the district and school level. There are some impact of the collaboration between Ministry of Health and Ministry of Education and Training. At the national level, the Joint Circular number 13, the regulation on the high care activity in school was signed between Ministry of Health and Ministry of Education and Training in May 2016. At the project province, the working mechanism or MOU which identify very specific role and responsibility of Department of Health, Department of Education and Training was signed in September 2016. And very key achievement that we have had in 2017, that is the National School Eye Care Guideline, have been developed by the project were approved by Ministry of Health in November 2017 to apply nationwide. And within the project, the joint monitoring visit conducted to the project area by a national PMB to monitor and provide technical support for provincial PMB. And how we manage the collaboration of national PMB. You know that the national PMB located in Hanoi, the capital of Vietnam, and at Vietnam, we have the small sub-office there, and we have the project coordinator based there to work with the national PMB. And the project staff work closely with the national PMB in order to provide support to prepare the annual plan, joint planning, funding request, joint monitoring plan, and preparation and review of the report. And our staff to maintain close communication with national PMB staff through the email, phone call, official or unofficial meeting, etc. And during the project implementation, we try to facilitate the national PMB participation in other project activity at the provincial and district level, such as in the annual project review, the workshop, the midterm project review, etc. And there are some benefits of the national PMB when they involve two projects. The first benefit is the implementation in project area in the Joint Circular number 13, the regulation on the eye care activity conducted in school. And secondly, the school child eye care model, when it belongs to the school health, is safely implemented in school and subject to be expanded to other provinces. There is strong support for circular number 13 at the provincial level. And when involved to the project, the national PMB is aware of the provincial child eye care policy gap, such as, for example, there's no regulation for optical shop, no technical specification for spectacle, and the gap in health insurance coverage for spectacle as not classified as a medicine. And when involved to project, the national PMB create the establishment and building a good relationship between the national PMB and provincial PMB. And we have also facing some challenge, and how we deal with the challenges that we face at the national level. You know, in Vietnam context, education and health domain are significant concern to the public and international NGO. So the staff of the department are very busy and fluent, and it is required a good relationship with the department. So the project team have to work close partnership and work as equal partner, not as donor, with staff of the department. And Vietnam Child Care Project is dealing with the policy issue at national level. So equipped project team with advocacy knowledge and skill are very important, and sharing learning to ensure successful project implementation is very critical to ensure a smooth operation of the project. There are some other challenges that we face during the project implementation, that is the health insurance. You know, in Vietnam, strabismus, prosthetic, low vision, refractive error are not covered by health insurance, and spectacles are not classified as medicine. To dealing with the challenge, we are working with other eye care NGOs through eye care working group for advocating for policy change with the government. Yesterday, I have attended this meeting and share the National School Eye Care Guideline with other projects, and they appreciate with the guideline. And another issue regarding to there's no regulation issued by government for optical soft requirement. To deal with this challenge, FFF is attracting to another project, better quality for better eye care project, by conducting a national survey on optical soft regulation and technical specification of spectacle and advocating to issue for the policy or regulation. Regarding some of the challenge and lessons learned at the provincial and district level, you know that our project, we are working project in 3 project areas, 1 province in the northern area, 1 province in the central, and 1 province in the southern area. And at provincial level, you know, school at provincial level, there are so many activities integrated into the school program, such as child rights, disaster risk reduction program, traffic accident. So school are very busy, and school only operate 9 months a year. So our project team have to work closely with project partner to try planning, implementing project activity, monitoring and review. And our project team have to build a good relationship with project partner through clear communication, respect, acknowledgement for partner contribution. And our project team have to facilitate positive collaboration between Department of Education and Training, Department of Health, in eye screening, comprehensive eye check, spectacle supply, eye care activity and training to prevent any delay of the project. And finally, there are some suggestions for working with the government agency in Vietnam. You know, in Vietnam, political contact, partnership with the government agency and government organization is mandatory. So partnership with the government agency are very necessary for project success. The international national staff should, firstly, before the project implementation, they have to understand the function, priority, and interest of the project partner, and identify clear role and responsibility of project stakeholder before project implementation is very important. And during project implementation, working together through trial planning and regularly monitoring is very important also. And staff should provide clear communication, provide timely feedback, and support through email, phone call, field trip, project meeting is very important. And if they are faced with some operational issue, besides a threat by project team should gain support and influence to other project partners. For example, to national PMB, to provincial PMB, I mean from the central to province. And finally, staff should provide timely encouragement, acknowledgement and pride to project partner and key member. And that is all for my presentation, sharing some experience within Vietnam Child Care Project. Thank you.
Thank you, Tuan. That was a really interesting overview of how you're working with the education and health sectors at the national and provincial levels, and some of the challenges and lessons learnt. Right, we are now going to have the question and answer session. So audience, this is sort of over to you now. I'm just going to make myself the presenter. Okay, and then, okay. Right, so I'm now back the presenter. So audience members, we've heard 3 really interesting presentations, so I'm sure you have quite a few questions that you would like to ask some or all of our presenters. So if you have a question, if you can put it in the chat section of your of the GoToWebinar, I'm just going to talk you through where that is. So if you can't see your control panel, there should be a sort of a white arrow on a orange background, which will, if you click on that, then you should be able to see things like your audio, dashboard, etc. And you should have a section there called chat and questions, and you should be able to ask your questions there. So if you do have questions, please do put them in, because we're going to basically take the next 20 minutes, and it's your opportunity to ask some questions, and we will only have about 20 minutes. So if you've got some questions you know, that you want to ask and you want to make sure you get them in, please do. If you're really struggling with the chat section and you still can't see where it is, then you can always email me. Obviously the invitation came from me, so you can always send me an email as well with your question if you can't access it. But I think what I might do, as while I wait for those questions to come in, I might just start by asking a question myself, which is about drawing on Arundhati's initial presentation. She was talking about one of the challenges can be with ministries of education and ministries of health to the prioritization of eye health within those sectors. So I'm going to start by asking Guan and Tuan, how did you manage to encourage the prioritization of eye health within both the Ministry of Health and Ministry of Education? What were your strategies that you used to be able to do that? And if we start, we'll just go in the order of presentations. So Guan, you've self-muted, so Guan, if you can unmute yourself and we'll hear from you first, and then Tuan, if you can go second. And then whilst they're answering those questions, if attendees, if you can please have a think about some questions for our panelists, and then send them across to us either in the question or chat section or by email. Okay, Guan, over to you. How did you help with the prioritization of eye health for the Ministry of Health and Education?
Actually, the project designed to working with health and education department. Then we felt it's also important to advocate disabled people's population to involve, because there is a low vision clinics in the project. So we were able to convince the leader of the provincial eye hospital. So then they approached to the deputy governor. The deputy governor is a lady and he had an eye problem. So the hospital director approached to her directly, asking for her support in coordinating to get health department, education department, and the disabled people's federation to jointly issue a formal document. So and we were also able to get this deputy governor to our opening ceremony. So this formal document is so important, and made all other project area at prefecture level and the county level. They said, okay, now we have a government official document. We should do this and we can do this. And also every time we invite not only health department staff to join, to come to our meetings or for training, or even we share our progress with these 3 sectors regularly. In the beginning, we are sharing it every quarter. Then when they were more familiar and more supportive to our project, so we share every half year. But for every annual meeting, definitely we invite staff or leaders from each of these 3 sectors at all levels, not only from at the provincial level, but also from prefecture level and county level. And also we will give them time to present what they know, what they would like to do. And not only for the meeting, because every annual meeting we will have discussion. We'll have pre-discussion. We will have some topic, and hospitals or school leaders, they will raise their concern, their challenge at the discussion session. So the leaders, they are able to listen, then they will provide more support. I think this communication among 3 sectors is very important, and sharing the information is really important to get all these 3 sectors. They are engaging in this project, and now they are really proud to be as a part of this, because when they talk to the higher level authorities, they will say, oh, we involved in Saints Believing Child Eye Health project, and we did this and we support that. So this is also like this project raised their profile at their department and also among different sectors. And another thing is at the meeting, these 3 sectors, the staff, they know each other very well, because when they assigned in a session, a discussion session, they can help each other for to solve their local problems. So I think communication, sharing information, and also recognize their contribution in this project is really worked. It's very important to get their support.
Yes, absolutely. That communication is really crucial. And what's really lovely about the project is that each of those groups have something to contribute, and they've each got different things that they can bring to the project and different strengths. So it's a real strength of the project that you've been able to bring all those different groups together. And I think it's also really important that they're able to see they can recognise the value of doing it as well, which is wonderful. Thanks, Guan. Okay, the same question to Tuan then. How did you help the prioritisation of eye health within the Ministry of Health and Education?
Thank you, Susan. In Vietnam context, to deal with the health issue, eye care issue, that we must cooperate with the Ministry of Health and Ministry of Education and Training if the health activity implemented as in school. And secondly, that in Vietnam there are the circular number 13, that is a regulation on the health activity organized at school, that is signed between Ministry of Health and Ministry of Education and Training. And we have checked the advantage of this regulation. And regarding to the Vietnam Child Care Project, we identify that we have to working together with both departments, and we have provide strong support and good cooperation with that department. The Ministry of Health and Ministry of Education and Training, they are based in Hanoi, the capital of Vietnam. So the Federal Law Vietnam, we have to set up the sub-office there, and we have project coordinator to deal in and to work closely with the national project PMB, I mean the Ministry of Education and Training and Ministry of Health. And we work closely and we organize the joint planning and monitoring together. We are not working alone. And beside the work, our staff work close communication with the staff of the department through the email, phone call, unofficial or official meeting. And regarding to monitoring at the project implement at the provincial or district level, and we try to facilitate the representative of Ministry of Health and Ministry of Education and Training to involve the project activity at the annual project review or workshop organized by at the provincial and district level. And in Vietnam, we have the iCare working group that is very good and strong and powerful that can influence to the Ministry of Education and Ministry of Health. And regarding to the some technique to work with the both department, I think that we are highly encouragement and acknowledgement and pride project for the contribution for any meeting workshop. And according to our project design, we have the meeting organized quarterly meeting to review the project with the national PMB, I mean Ministry of Education and Training, Ministry of Health. So that are what we are doing to influence the Ministry of Health and Ministry of Education and Training. That all.
Wonderful, thank you. And sounds like having that working group where you're able to bring people together and have a stronger voice has been really important for you. So no, that's really wonderful to hear. Okay, thank you. So thank you both for those responses. We have quite a few questions coming through now. So thank you, audience, for thinking of your questions. And please do continue sending them across. And I'm going to theme some of the questions because there's a couple that are quite similar here. One is from Ngoc and Phan, which is around, and Sally as well, Sally Crick, the same kind of question, which is around, usually government partners are very busy. So what are your experiences in planning the project activities to mitigate the risk of delay in project activity implementation? And from Sally, it's what was your original timescale for working with the national and provincial, was your original timescale for working with the national and provincial levels realistic? And did you actually need more time in the project to influence or work successfully with the government? And so I might actually start with Arundhati. Do you have any response to these questions around time, how it's affected timescales or delays in implementation? We'll start with Arundhati, and then we'll go for Guan and then Tuan. So anything on sort of timescales and how these have had to altered within the project?
Basically, when we are signing a memorandum of understanding with the government.
Sorry, Arundhati, you're really quiet again. Is it possible to move a bit closer to the microphone? Sorry to interrupt. Just so we can, we really want to be able to hear your response.
Okay, am I audible now?
It's a little better, yeah. It's still quite quiet, but it's a little bit better.
Yeah, like when we are signing a memorandum of understanding with the government, at the same time we are also like chalking out a plan of action to implement the memorandum of understanding. There are some scope of work within the MOU which we are signing jointly. So there are common like sharing of responsibilities along with timelines. So it's like periodic reviews are also like we are conducting just to see whether we are on track or not. But definitely if the person changes, I mean if the officials are changes, there are delays like sometimes like beyond control. but definitely periodic review and also like visits of the government officials to the field and conducting joint review meetings. It helps to implement the plan of action and on time and avoiding delays. That's all from my side.
Thank you, and that's really an interesting point about the MOUs and having that agreement at the beginning, and also trying to embed the, the monitoring and evaluation in the sort of the government's own systems of review. Oh, I'm just going to mute you now, Arundhati. Okay, so Guan, the same question about, were your original timescales realistic, and did you have to make any? Did you need more time, or how did you manage that?
I think for the original time or plan, it is okay. Although sometimes we facing challenges with local partner, not from the 3 different governmental authorities, but sometimes it's from hospitals. So we will have annual meeting, so we will discuss and share work plan with hospital partners, health department, and disabled people's federation, and we will ask them whether they have any problem or challenge to do this. Then they will discuss among each other. So some hospitals' experience will be shared with other hospitals. So actually, for the time frame, it is okay in this project. So it is fine. And also, we also ask our local partners to develop their work plan and share with us, such as for the work plan and the budget, using the requested budget. Every quarter, they will send their work plan and the budget to provincial eye hospital, and we will review it. We will ask them. So it's generally, for time frame, it's fine. For the second question about whether we need more time to influence or work successful with the government, I think yes, maybe a bit more, but maybe it's not like a full part of this project, such as maybe can do like a different phase of project, because some activity or some part of project, it is okay. Maybe just a small part for some weak one, like in our project for low vision service, low vision capacity building. This is, we feel, still need more time to build up, to make all low vision staff, they are very confident for their skill to distribute it to those really multiple disability children. But for simply just visual vision disability, it is fine. But for some children with multi-disabled, like with cerebral palsy or with Down syndrome, it seems some of them, they are still not confident. So generally, I think, yeah, the time, it is okay. But for some activity, maybe if more time, it will be better. Thank you.
Thanks, Guan. So yeah, that's great that sort of at the project level, having these sort of annual meetings is important. And it's interesting that you sort of mentioned again with the local partners, having that sort of, it's almost what you said in your presentation, bottom up ideas of making sure that they're setting sort of realistic expectations. And yes, that the policy sometimes is more than just a project, but is almost like a phase, like you say. So that's really interesting. Thank you. And then Tuan, same question to you, please.
Okay, thank you, Susan. Yes, at the beginning of the project, we faced some delay in the late approval of the projects by provincial level. And you know that this project is dealing with the advocacy and policy issue at national level. That is required and take a long time. Then and we facing with more challenging at the than at the provincial level. But according to my figure, and this is now better controlled by project team. First of all, we will try to take advantage of the working mechanism between the Department of Health and Department of Education and Training, because that is decide, identify clear role and responsibility of the each department in implementation of project activity at province level. And secondly, regarding to project team, we are making the work plan, try planning with the all project partners together. We are now not working work plan alone. All challenge the issue regarding on eye screening comprehensive eye check at the school was share, and we are together have solution together by better planning. For example, if the eye screening start at the beginning of a new school year, I mean in September, we are preparation together in June or July together. And regarding to the to prevent for any further delay, that we are trying to advocate, and we try to have the support from the central to provincial level by invite the national PMB in project province. For example, in any project review workshop organized by provincial level, and we also bring this issue to discuss within eye care working group for better solution, for lesson learned, for sharing appearance together. That is all. And according to my financial figure, and now we are spend around 60% of approval budget, about $650 for the whole total of $2.2 million. It means that we have 40% of budget to be spent within 2018 and 2019, and we are very confident that we are achieve all the target and spending by the end of the next year. Thank you.
Okay, great. Thank you, Tuan. Excellent to hear that the project's going to spend out on time. We always like to hear that, and seeing is believing, so that's wonderful. And thank you for those ideas as well. Again, there's a similarity with the Guan's actually around planning with project partners and including the key decision makers and stakeholders in your kind of annual review. So that's really interesting. Right, now we've got a couple of questions remaining. So if you'll just bear with me, I think we might go over the hour slightly, but I think these are some really nice questions that I would like to ask. So one is from Helen Wang, and it's for Guan specifically. So she says in Guan's presentation, one of the strategies is sensitive and utilize relevant policies, which is on slide 3, and she'd like to learn more about how they work, how you work on that. So that's specifically for Guan. And then as a really nice question to finish from Lisa Sylvester, which is for both Guan and Tuan. And she says, I'm wondering if they can see similarities and differences with how they are working with the governments for both of their projects after seeing each other's presentations today. So, so Guan, if we start with you, and you can start by answering the specific question Helen had around sensitive and utilize relevant policies, and then go about what's been your learning from participating in the webinar and listening to what how Tuan is working with governments.
Thank you. For the policy, using policies of different departments, because we found that one, it will be like a common language for us. So when we approach to different sectors, we can not like just we go directly to talk to the education department saying, oh, you should participate in this project, in this child eye health, because it's children it's also in school. So we used one very powerful example is we used a letter or issued by health, sports bureau, and also for education department in late 2016. So it's just but it happened we found there is this letter. Then we print out this letter and we approach to the provincial bureau of education. We invite them to our annual meeting in December. Then we said, okay, you say we our health department, we are working for to improve the child eye health from medical or clinical part. And we know now you health education department also have a letter jointly with health insurance health sector. So maybe we can work together and improve child eye health so that they can study better, because it is also one of your objectives to improve children's academic achievement. So the chief of sector, he was so happy. He said, how do you know we have that? I don't know that. So he said, oh, let me see that. So he read that and he said, okay, yeah, it's actually from the minister level. Our 2 sectors or 3 sectors already really concerned about myopia prevention and treatment for children. So this is really, we saw this example is really make these leaders, they are happy. Then he came to our annual meeting and he made a presentation. And also we found out another example in 2015. We found there is called survey or for disabled people's federation. It's for survey on basic needs of disability. So it is not from us. We don't know that, but it's told by people from county level who is working with in disabled people's population. So we went through this survey online, and then we approached to the provincial disabled people's federation. We said that we would like to support this survey if you agree or if you would like. So maybe we can jointly to do this together, not formally for the survey, but we can support to find out children with disability in community. So they will say, oh, you also know this. Oh, that's very good, because you are more, a health department is more professional. So you, thank you for allow us can use your eye health team at provincial level, county level, prefecture level. So I think if we know some of this, we are very sensitive to some new policy, and it is linked to related to health and to their like disabled people's federation or health department. So we can have a common language, common interest, common goals for 3 sectors. It's like it's also linked to one of my other key strategies about resource combining. Actually, it's like we combine the resource, human resource, and low vision devices from disabled people's federation. I think these are really is also make our work much more easier when we use these. Thank you.
Thanks, Guan. That's really interesting, and sort of explaining about how you work through the protocols within each of those sectors. And yes, absolutely bringing the resources of each one of those groups together. Lovely. And then just about Lisa's question, what do you see as the similarities and differences of working with the governments after seeing Tuan's presentation?
I think that the similarities about we both working with education department. Maybe two countries has different, slightly different for education department. I realize in Vietnam it's called not only education, it's about education training. So for deeper, I don't know, but I think yeah, we both working for with education department. We all realize this is very important for improving child eye health. For differences, I think yeah, they as China is too big, so we were only able to advocate or influence the provincial level. But Vietnam, they were able to work with national level. So this one is really very powerful. I hope our project can influence more at a national level. Thank you.
Great, thank you, Guan. Yeah, that's really interesting. Okay, then the same question over to Tuan. So after hearing Guan's presentation, what do you see as the similarities and differences?
I think that the China and Vietnam, we have the same political and administration contact. So I think that almost the same. And regarding to the Vietnam Child Eye Care project, because our key target group is primary and secondary school at the age of 6 to 15 years old, and all the students have to go to school. That's why we have to cooperate and partnership with the Ministry of Education and Training and Ministry of Health. And within Vietnam contact, both ministry, they have signed the circular number 13 together. And that's why we have to work through that partnership with the Department of Student Affairs and General Department of Preventive Medicine. That is what our project is doing. And a little bit different that in Vietnam context, there are the international NGO networking, and we are working in eye care working group. And the eye care working group, they have the key member from Facilitator Vietnam, the Orbis, Brian Holden, Sightsavers, PCM, and BOMB project. And we are sharing and updating project together, and also discussing for any challenging that each project is facing for better solution together. And in Vietnam, the Vietnam School Eye Care project is led by Facilitator Foundation, and while advocacy project led by Orbis, according to the agreement that I have the chance to extend yesterday. I think the networking with other NGO is quite a little bit different with China. That's all.
Okay, thank you, Tuan. And that's really interesting. It's interesting that across both, you said that, the value of working with the Ministry of Education, obviously, because you're working with children, is absolutely crucial. So thank you both for that. Right, now, unfortunately, we've come to the end of our question and answer session now. So sorry if you weren't able to have the opportunity to ask your question, but if you have anything that you still want to ask, you can email me and I will forward your questions to our presenters so you can connect up with them directly. So I would now like to introduce Sally Crook, the Programme Manager for IPB, for some concluding remarks. And so Sally, I'm just going to unmute you. Yeah, Sally.
Hello, everybody. I hope you can hear me well. What a wonderful presentation, well, set of presentations that we've just heard today. I think, Arundhati, you really sort of set the scene about, you know, how we all need to consider how we're working with the governments for, well, for sustainability. And obviously, we talk a lot about health systems approaches to really to create, you know, the largest change possible and to bring eye care to as many people as possible. But I particularly liked these two presentations, although they were both focused on child eye health issues. I think there's so much learning that we can gain in how we're going to you know, create these sustainable eye care systems for all age groups. And I just I would just highlight, I just thought Orbis's, your slide, the one that was called strategy slide, I just loved the idea that, you know, you had all these different strategies to address so many different issues that you found in working, and you were working across 3 districts, across 3 sectors in the province, but that you really needed to work with all of them. So you had to engage with all of them, find out where they were, what were their issues, what were their problems, and then bring them all together. And I just think you have some lovely examples there of how you had to be working and be very nimble to cover all of those 8 issues that you brought up there. But as the slide which was about your specific responses, where you only presented on 2 very specific issues, you know, how much work there is across all those issues to really to move you know, quality eye care to both the school age population, but also the preschool population, and then obviously very specifically the disabled population. But I think it shows how busy you've been, and although yes, Orbis is only working at the provincial level, I happen to know that, you know, they've screened over you know, a million school children, let alone all the other children. So, you know, they've really managed to create a great sort of working model at the provincial level there. And then from Vietnam, again, I thought this was a very nice example of how, you know, you can't just work at one level. And I happen to know that Fred, in Vietnam, you've sort of you developed this specific Seeing is Believing project in response to a lot of learning that you'd had in the past from working at the provincial level, and you felt that, you know, this joining up of well, you have to join up 2 ministries, but also to join up the national and then the provincial level. And obviously just the timelines of how, you know, the joint circular came out from the Ministry of Health and the Ministry of Education, but then it needed to go down to the provincial level for all their roles and responsibilities. And then you actually needed guidelines at the school level so that the schools knew what were their roles and responsibilities before, you know, the work is going to be delivered nationwide. And I did just feel that, you know, slide 8 on your achievements, this is really key. And again, you know, you said how you had to open an office or a sub office at the national level to be close to the national teams from both the Ministries of Health and Education. And then you also need, you know, to support the provinces to be able to provide the pilot study so that people can see how this would be delivered in practice. And so I think, you know, both the China and the Vietnam presentations today have really shown, and I would use the stronger together little slogan that we have here at IPB to say, yes, you know, you've had to work across a lot of different partners at the country level to really maximize the benefits. And you know, that partnerships are necessary, but you really need to have a plan how you're going to make it successful at all these different levels and with all these different people. And it requires a lot of understanding of the people and the systems that you're working with, and that we can't do it alone. We need a lot of support from lots of other people to deliver a successful project. So many thanks to our three presenters. I've just really enjoyed this morning. Thank you so much.
Thank you, Sally. Thanks, Sally, for that excellent summary of the presentation. Sort of got it all together in a nutshell, which was really lovely. So that's the end of our webinar today. So I'd like to end by thanking our presenters, Arundhati, Guan, Tuan and Sally, for their comprehensive presentations and responses to all the questions. Thank you to Emma for all the technical support. And thank you to everyone who's participated. I really appreciate you all taking the time to be part of our Seeing is Believing learning community. As Sally said, we are stronger together, so please do continue to engage with us. And then I just have one final favour. I'm now going to email all of you the Seeing is Believing webinar survey. And if you can please just take 5 minutes to complete it. As I mentioned before, your support for these webinars makes them possible, and your feedback does help us to improve them. So thanks again to everyone, and I look forward to seeing you all at future Seeing is Believing webinars.